I don't have insurance, and I have asthma, which makes it difficult for people to want to take me as a client, and I'm a farmer, and again, that puts me in a high-risk category. I believe that this is such an important problem that I've decided to run for the state senate in order to make this, the health care reform, the primary focus of my campaign. I very much want to see a solution. People are suffering. People are hurting out there. It is time that we roll up our sleeves and do something to help people. It is an extremely important issue, and we need to focus on it as a community and as a group of legislators, as leaders. This is, for me, the most important issue that people have to deal with.
Well, one of the concerns I have is I'm retired now. I retired early because of health.
Okay.
Now no insurance.
Oh, you retired early because of health concerns. Okay. What?
Because of health.
Yes.
Yeah.
I understand. So, did you have COBRA? Did you go with the COBRA extension for 18 months?
Yes.
Okay. And now, what's the situation?
Well, I can't afford health insurance now because of retirement.
Do you know what your cost would be a month? Are you still working, sir, or are you also retired?
He's retired.
Okay. And are you covered under anything at this point?
Well, I got VA.
There you go. Okay.
But if something serious happened to me, there's a lap before I went into the VA.
Okay, what, into the hospital, VA hospital, you mean there'd be a lag?
Well, yeah.
There would?
Yes.
How is that?
That's kind of the way it's set up, I guess.
Okay, I don't understand.
Like if he should have a heart attack or something, I mean, he has to be into another hospital and
then transferred to VA?
Yes. Yeah.
Okay, I
You've
see.
got to be stabilized before they'll...
I see. So there'd be that stabilization cost that you would be concerned
Right,
with.
I get it.
Because you're not on Medicare yet.
no,
No.
not yet.
Okay.
I got about 6-7 months before I get a medical.
Good. Oh, good. So you're probably going to be just okay.
He'll be fine.
More than
You'll be
likely,
fine.
yeah.
Okay. Now, may I ask how old you are?
59.
Okay. And so you've got from 59 to 65 to go to
that's
be
right.
covered. So you have a 6-year period here that you're very concerned about.
Yes,
Because, okay, may I ask also what it's costing you per month? Do you know what it is per month for health insurance? Do you have anything now?
I am. No, I have nothing right now.
Nothing right now. Okay, we've also got rural health care cooperatives that are starting up around the state, and I wonder if that might be of assistance to you.
Healthcare cooperatives would bring different farmers from the same cooperative into a pool. It would require health insurance companies to make the decision to enroll that pool of farmers. It would be a voluntary decision on the basis of the cooperative to be able to do it. Unfortunately, because it's voluntary, meaning the insurance company has to decide whether or not they want to do it, none of the insurance companies to this point have agreed to be able to take in the farmers. The bill was originally passed in 2003. 2006, it has yet to enroll its first farmers. The reason is because the insurance companies voluntarily decide whether or not they're going to take them. They didn't want to take them before 2003, and they didn't want to take them after 2003. Creating cooperative care didn't solve the fundamental problems of the health insurance system, which are that their insurance companies are allowed to pick off the people that are the healthiest and the lowest risk, and they leave the people that are the highest risk in without coverage, like myself, or with very poor coverage. What we need is a system that would put everyone in the same pool and make insurance work like it was supposed to work.
Eau Claire School District was going to have an increase of 35% in their health care for their employees for this next coming year. And I talked to Altoona school board member who said it was 18% they're projecting right now. So there's really a lot of difficulty with school districts trying to find the money.
I thought it was really interesting, the fellow who said, think if you can control healthcare costs, you can actually lower taxes or at least keep under control the expenses of the public sector, because you've dealt with what's this part that's totally out of control. Oh wait, I never thought about explaining it to somebody.
Just imagine if we could cut those costs by 50% across Wisconsin, 426 school districts.
And the other part of it, one of the things we talked about in my plan is stabilizing the costs. And we're looking at, 12%, 15%, 19%, 20%, 35%, and it's on top of what we increased last year and the year before and the year before. So the costs are out of control.
And that's one of the problems for school districts in their budgets is trying to come up with those projections, not just this year, but the year after and the year after, and not knowing where those costs are going because we know they're out of control. They just are.
Coming up in a few minutes, the State Senate Select Committee on Health Care Reform will convene in the nearby auditorium. This task force was recently formed by Republican legislative leaders, but sadly it is a task force that is focused on the wrong task. The committee's leaders are going to tell you that the group was formed to look into the problems of health care access and affordability and propose reforms for the state of Wisconsin. But that is not its real mission. Its true goal is to provide political cover and election year diversion from one inescapable truth. This legislature has again failed to take any meaningful action to help cover the 500,000 people in Wisconsin with no affordable health care or health care security. A hearing like this is a classic case of too little, too late. The 2006 session is all but over. The remaining couple of days left for business aren't nearly enough to debate and enact significant reform. A show like this only provides the illusion of actual work. Now, for years, you and I and plenty of other people have patiently played along with these political games from the current legislative leadership. But after more than a decade of such listening sessions, it's clear they haven't been listening to the people who really need help. The people who are going to be talking here today may as well be talking to a brick wall, for they have been pawns in just a political game.
And one of the things that has not really been mentioned at all today is how this healthcare system affects patients. Patient care is what we're supposed to be all about. And I do not believe that healthcare should be for profit, just to get off on the right start. And it seems to me, I don't remember who said it, but that definition of insanity is to keep doing the same thing over and over again, expecting different results. We keep talking about how the market is going to cure the healthcare. Healthcare is about people. It's about interactions between a patient and their provider. You asked the wrong questions this morning, Senator Erpenbach, when Pete was up here talking about why don't doctors do the right thing the first time. It's because the payer will only pay for the cheapest intervention. And then when the cheapest intervention doesn't work and the patient has to come back, the provider is held accountable as not providing good care initially.
And I would just say, as we decide whatever it is that we intend to do, because we do realize we have limited resources. The sky is not the limit. People cannot expect everything under the sun to be done with and for them or their loved ones. And as we look at what is the best approach, I would say personally, we have to absolutely be focused on the marginated and the poor. That should be the center of reference, because I think that is an expression of reality. That is the group that is most easily forgotten in these kinds of discussions. And that is the group that oftentimes endures all kinds of frustrations, physical, health-wise, etc., put things off, and add to the burden of a quality of life that neither you nor I would say is acceptable.
There is, in the premium model, somebody who is making $7 an hour is paying the same dollar amount in their premiums and the same deductible amount. When I worked at home care, I guess I maybe shouldn't say who, I was a manager. I was a nurse in the field, and then I was a manager, and I was making roughly about $20 an hour. I was paying the same premium prices as my people who I was supervising who were making $7 an hour. These people were taking home about $150 a pay period because their premium costs were taking away their entire paycheck. And then they would take on a different job to be on their live-on expense. I have been in people's homes that live with dirt floors in this community, in this county. I have seen the devastating extent of poverty. There is a Health Affairs, the Policy Journal, did research in 2001 with almost 1,700 personal bankruptcies. Of those, they found that over 50% were directly related to out-of-pocket medical costs. So you can have health spending accounts or health savings accounts as much as you want to. There is no way that a person making a low-level income can put away enough money to prevent them going bankrupt if something bad happens to them or their family member. And the convoluted part about this, though, is that people use their credit cards to pay off their medical debt. So then when they did this bankruptcy law and they talked about consumer debt and credit card debt, they made it sound like this was a bunch of people out spending money at the mall all the time, instead of people who were spending thousands of dollars paying off their health care bills with their credit cards and then having to pay 18% interest on their health bills. So we can just keep talking about how business is going to solve the problem. Business clearly is not going to solve the problem. Business has been in charge of this problem for decades. I've just sort of had it with that line of thinking.